Globalization and international migrations have caused cultural diversity in societies, and hence nurses in different societies have patients with different cultures and different cultural needs. As we have learned from our readings in this class, cultural diversity can be a major barrier to effective care delivery. Nurses' lack of knowledge and skills about how to effectively deal with patients from different cultures may impair their relationships with them and result in inequality in care delivery. Consequently, cultural competence has become an international demand. Leninger has defined cultural competence based on the different dimensions of culture, including values, health beliefs, religion, and philosophy. Despite the crucial importance of nurses' cultural competence in health care delivery, there is no clear guideline for the clinical application of the concept. Different concept analysis studies have been conducted so far regarding the concept of cultural competence, but they all provide contradictory results and did not cover all aspects of the concept. Nurses' lack of cultural competence can impair nurse-patient relationship and result in negative health outcomes such as loss of screening opportunities, diagnostic errors, adverse drug interactions, and even early death. Due to the ambiguities surrounding the concept of cultural competence, this concept was selected for analysis by me. The concept of cultural competence includes the two subconcepts of culture and competence. Merriam-Webster's dictionary defines culture as the customary beliefs, social forms, and material traits of racial, religious, or social group, and also the characteristic of features of everyday existence, such as diversions or way of life, shared by people or in a place and time. In nursing literature, culture is defined as a learned paradigm shared by a group. Leninger refers to culturally competent nursing care as creative, sensitive, and meaningful culture-based use of the health and care knowledge to coordinate the needs and the usual ways of living among individuals or groups. The core concept analysis is to determine the defining attributes concept, or in other words, a group of attributes which have the strongest relationship with the concept and allows for deep insight and easily obtained. The most common defining attributes of cultural competence are cultural awareness, cultural knowledge, cultural sensitivity, cultural skill, cultural proficiency, and dynamicity. Cultural awareness is to understand the effects of one's own nature. It helps individuals assess their biases and prejudices and forms a basis for valuing others' beliefs and values. It can be used to identify the similarities and differences in other cultures with one's own culture. Cultural knowledge is continuous information acquisition about different cultures. It includes the learning and conceptual and theoretical frameworks which help data processing. Cultural knowledge is the basis for cultural understanding. Cultural sensitivity is to value, respect, and admire cultural diversity. The characteristics of cultural sensitivity are knowledge, attention, understanding, respect, and optimization for intervention based on the patient's cultural needs. Cultural skill is the ability to establish effective communication with individuals from other countries. This ability is a consideration of different beliefs, values, and methods in planning and providing care. Cultural proficiency refers to the acquisition and the transfer of new knowledge through the conducting researches using culturally sensitive therapeutic approaches. It reflects the commitment for change. And lastly, dynamicity implies, and I'm not sure if I'm pronouncing that correctly, so please forgive me, implies that instead of being a culturally competent nurse, a nurse is becoming culturally competent through frequent encounters with different patients, which experience essentially. The article then went on to give a model case where the healthcare provider was culturally competent. The example of the competent healthcare provider exhibited all dimensions of cultural competence, so all six, in his relationship with the patient of a different culture. A borderline case was also given. In a borderline case, the example exhibits most of the defining attributes of the concept being studied, which in this case is cultural competence. Furthermore, a related case was also given. In a related case, the instance is related to the concept but does not contain all the defining attributes. Lastly, a contrary case was given. In a contrary case is kind of what it sounds like. It is an example where the concept is not at all applied. A nurse's cultural competence reduces the effects of cultural and ethnic discrimination on care and gives a sense of worthiness to patients from different cultures. Moreover, it minimizes the likelihood of malpractice, enhances patient trust in healthcare providers, promotes their treatment adherence, improves effectiveness, promotes public health, reduces healthcare costs, and lowers morbidity and mortality rates. Based on the presentation analysis, we can define cultural competence as a dynamic or evolutionary process of acquiring the ability to provide effective, safe, and quality care into individuals from different cultures, along with considering the different aspects of their cultures. In conclusion, cultural competence is one of the principal foundations of clinical nursing that is affected by the immediate financial, political, social, historical, and cultural context. Cultural competence development is a dynamic and evolutionary process, as previously stated, which necessitates personal desire and effort, effective education, and organizational support. It gives nurses a sense of self-empowerment, provides patients a sense of cultural safety, and improves the community health outcomes. So the article was extraordinarily well written. It leaves almost nothing out, nothing to question. The outline of the article makes it very easy to follow along. Also, the subtitles previous to the information sections caused the reading to be really effortless because you knew what you were going to get into before you even began to read. You knew where the article was going to go before it took you there, basically. Furthermore, a total of 43 articles were used in its creation, and it is peer-reviewed. And it also includes the finding of many other studies, either agreeing or refuting the evidence provided in detail of the previous studies. This paper adds much to what has already been known in regards to cultural competence in nursing. Also, this paper shows what cultural competence is, and it also shows that reduction in healthcare inequalities, enhancing patients' trust in healthcare systems, and cultural safety are among the main consequences of cultural competence. I also learned that nursing education system and healthcare organizations have significant roles in improving nurses' cultural competence. Boom.